Okay, thank you so much. We are happy and glad to have you. We first and foremost having our annual retreat. AYGF is having her annual retreat, bringing all her staff together from different locations to empower and train on different aspects of development work and strengthen the institution. But importantly is also the fact that we are presenting the impact report of one of our projects called Accelerated Nutrition Results in Nigeria. AYGF is implementing the Accelerated Nutrition Results in Nigeria in Kogi State and Niger State. This is a project funded by the World Bank through the various state governments. Within the period under review, since the project was signed on to since June and May-June of 2021, we have made a lot of impacts on the target population, that is children of under 5, pregnant lactating women in the target states. We have also supported a huge number of the target population with these services. We have provided several of the services, including vitamin A's, folic acid, ORS, albendazole, and micronutrient powder, among others. We altogether have been able to extend the services to well over 4 point something million people, contacts across the various local governments. In Kogi, we are in 10 local governments. In Niger, we are in 13 local governments. So today, we presented the report of our impact to members of the public, the media, and to say that we also are ready to do more, in the states. We are very concerned about the nutrition conditions, in the country. A lot of malnutrition cases, in the communities that are not even discovered, but through the ARIN project, we have been able to discover a lot of severe acute malnutrition cases, and we have been able to provide support, to these cases. To these persons or children, and they have been able to recover, and now fully restored to normal, health conditions. And we believe strongly that this is just like a drop in the ocean. There's a lot of cases that, we have not been able to discover. But with more support and more funding and more partnership, we will be able to, extend these services to as many communities as possible, not just in the states we are currently working, but even across the country. We're also using this opportunity to call on the federal government, the state government, to invest more, on nutrition, because we have a lot of, households who are going to bed hungry, and also a lot of children of under 5 who are victims of that situation, of that condition. So we are calling on government to prioritize nutritional support, to the most vulnerable in the community. Public health generally is very expensive. And so we're also asking that, as against the current level of budgetary provision for public health, system in the country, both at federal and the state level, that government should do more to improve their current level of budgetary provisions, and that any element of corruption to undermine the correct application of these resources should also be addressed, so that the right value for money will be truly, gotten for the people. And importantly also is the fact that the public, health sector is a sector that needs huge investment, but strong partnership to deliver. That you need strong partnership from foreign donors, foreign partners, to the state governments, the federal government, but importantly, partnership with the communities, partnership with the beneficiaries, partnership with the local people, because they are the people to sustain the results and the efforts on the ground. So we should design projects that guarantee sustainability of all, support we are providing, for the people, so that even after the project ends, the people should be able to sustain the impact at least for significant, period before any disconnection happens, on the impact of the project.